Hello, welcome to this podcast on understanding the central venous pressure waveform. This is a production of the Yale Anesthesia Media Lab. My name is Dr. V.G. Kurup. I am an associate professor in anesthesiology at Yale, and the animations are made by Erika Zador. I'm sure many of you, like me, have placed central venous pressure lines and have spent many hours staring at the monitor with those squiggly lines. As a resident, it took me some time to finally understand the meaning of those squiggles. Although I had learned about them in medical school, the clinical correlation was difficult. The best way that I see to understand the meaning of the central venous pressure waveform is to imagine you're at the tip of the catheter looking out into the right atrium. If you assume normal compliance of the heart walls, the pressure tracings will reflect the volume in the heart chambers. Every time there is an influx of blood into the right atrium, the pressure in the chamber increases and there is a positive wave. Every time there is a flow of blood away from the atrium, there is a decrease in pressure in the right atrium and there is a negative wave. So let us look at the cardiac cycle a little closely and correlate the different volumes with the phases of the cardiac cycle. Now keep in mind that cardiac electrical activity precedes the mechanical activities of systole and diastole. There are three positive waves on a CVP tracing, the A, C, and V waves, and two negative waves, the X and the Y descent. The A wave on the CVP waveform represents atrial contraction. During this, the pressure inside the right atrium increases. As you can imagine, if you're looking out of the tip of the catheter, this represents an increase in the pressure in the right atrium, causing the positive A wave. I remember the A for atrial contraction. After this, the pressure in the right atrium decreases, causing the X descent, which correlates with declining pressure after systole when the atrium is pouring the blood into the ventricle. After this, the tricuspid valve closes and it produces a small bulge into the right atrium, causing a mild increase in the pressure in the right atrium, which causes the C wave. And you can remember the C for closure of the tricuspid valve. Next is the period of atrial filling, which, as you can imagine, again increases the pressure in the right atrium, causing a V wave. Now, after atrial filling, the tricuspid valve opens. Most of the blood in the right atrium passively empties into the right ventricle, again causing the atrial pressure to fall, and on the CVP waveform, this decline appears as the Y descent. The A and the V waves are almost at the same height, indicating that atrial systole and atrial diastole produce about the same amount of pressure. Consequently, right atrial pressure is recorded as mean values because they're almost the same. And the normal mean pressure of the right atrium ranges from 2 to 6 millimeters of mercury or 3 to 8 centimeters of water. You will see sometimes pressures reported in centimeters of water or millimeters of mercury, and here is how you would convert them. Now, how do you correlate the CVP waveforms to the waveforms on the EKG tracing? Here you can see the tracing of the EKG, and we can correlate the different waveforms in the CVP to the electrical activity in the heart. The P wave on the EKG reflects atrial depolarization, which is then followed by atrial contraction. This increases atrial pressure, and corresponding to the PR interval on the EKG, you see the A wave sequence on the CVP waveform representing atrial contraction. The X descent on the CVP waveform represents atrial relaxation and the declining pressure after systole when the atrium pours out its blood into the ventricle. This happens right after the QRS complex. As the cardiac cycle progresses, the tricuspid valve closes, producing the small backward bulge known as the C wave. The atrium, filling with venous blood during diastole, produces another rise in pressure and a V wave, which corresponds to the T wave of the EKG.